The National Institutes of Health, or NIH, is tasked with solving our country's complex healthcare problems through medical research. The agency awards grant funds to researchers who make important discoveries to improve health and save lives. Recently, Elizabeth Beth Merwin, Executive Vice Dean at the Duke University School of Nursing, and her team, together with her co-researcher, Emily Howenstein, Senior Associate Dean of Nursing and Healthcare Innovation at the University of Delaware, were awarded nearly $3 million for their 3-year NIH proposal reducing health disparities in seriously mentally ill, disabled, rural, and minority populations.
So this study is going to let us study the entire Medicare population for the country, conduct a national study, and let us look over up to 14-year period of time at how people take care of themselves early on, their self-care management, their health behaviors, their health risks, affect their health status, and ultimately how their receipt of good quality care makes a difference in health outcomes, and ultimately mortality over about a 14-year period.
The study will examine the effects of disability and comorbid mental illness of Medicare recipients under 65. It examines self-care capacity and its relationship to health status. This will help Medicare address one of its most challenging problems: disparities within the populations that utilize Medicare.
The issue of health disparities is one that we have found as a country difficult to overcome, and addressing it for the whole. For example, we do make Medicare policy and what is covered by Medicare for the good for all. But it's time that we take a look at the specific needs of populations that may not be as fully served by policies that in general work well for everyone.
Dr. Merwin says the study will focus on disabled and mentally ill populations that utilize Medicare, a group we know little about.
So particularly, this will focus on the disabled Medicare population. About 8 million people become eligible for Medicare because of disability. They're under 65. And very little is known about the needs of this population, and we'll be particularly focusing on the disabled and also on those that have mental illness or throughout the Medicare population.
Dr. Merwin says her experience working as a clinical nurse in mental health has given her a strong foundation on which to base the research.
I've been working in the area of rural health and rural mental health and care for different vulnerable populations. A lot of my work has been particularly related to the African American individual residing in rural areas or utilizing the mental health system. And some of my work and prior work of teams that I have worked with have shown that there are a lot of disparities. But the problem is it's very hard to determine all that's going on, because you usually have small groups of people that are residing in the rural area, small percentages of the population sometimes that are a member of a particular minority population. And what we know from some of our prior work is it does matter if you consider together, does someone reside in a rural area and are they a member of a minority population? There's some of our work would suggest you have to consider the influence of both and figuring out what is the most needed care or what will work and what will best meet the needs.
Dr. Merwin's past experience as a clinical nurse isn't the only asset she brings to the study. Her long track record of research combined with big data will also contribute.
I think my clinical experience as a nurse and my experience as a director of nursing of a facility way back got me into this area when I could see the disparities in patient care and unmet needs of clients. But particularly when I decided to get a PhD in health services organization and research, I focused on learning to use national data sets and secondary data when it wasn't popular to do so. And so I have 30 years of experience in using big data, and the computer systems and the data systems have only improved over time. And this study lets me take my methodological expertise that could only have been gained over time and incorporate really complex data sets to put together to be able to answer these questions. And I'm challenged by it, and I'm excited by it.
According to Dr. Merwin's co-investigator, Emily Howenstein, morbidity and mortality among the disabled seriously mentally ill is excessive, preventable, costly, and causes unnecessary suffering for this vulnerable group and their families. This research seeks to understand the root causes of preventable illness among those with disabling mental illness, and with that knowledge, propose targeted individual and system-level interventions to improve health outcomes.
This could have a lot of implications for policy decisions within Medicare. And certainly as nurses, we are always developing better ways to provide care, changes in practice, influencing evidence to guide practice, and developing clinical interventions that could be tailored to the particular needs of different subpopulations that we'll be studying.